Hello and welcome to the heart. So first of all, the heart is located, I think we all realize, in the chest between our lungs and between the sternum and the vertebral column. That area is called the mediastinum, so that's the technical location for the heart. The heart is also well protected by several layers of fibrous connective tissue. The first outermost layer is going to be the toughest one, so that's called the fibrous pericardium. As you can see here, it's tough, it's inelastic, meaning it does not stretch, and it's made up of dense, irregular connective tissue. If you remember back to 201, that's the same kind of things that make up the white part of your eyes, for example. This basically is what's protecting it from overstretching, and it also allows it to anchor to that chest area, so as it beats, it doesn't just jump around in your chest cavity. There's the serous pericardium, which is more delicate. There's a parietal layer and a visceral layer. So basically on that wall of the fibrous pericardium, and then on the surface of the heart itself is a serous pericardium. The visceral layer, which is on the surface of the heart itself, is also called the epicardium. We'll see that term again in the next slide. And in between those two, there is pericardial fluid. That's really important. It's a major friction reducer. So the last thing you want is for your heart to stick to the fibrous pericardium every time it beats. On the heart itself, again, so we have the epicardium, or the visceral layer, the serous pericardium. Either term is correct. It's smooth, slippery. Again, that makes sense. It's there to help protect the heart as well as prevent it from sticking. And the actual muscle of the heart is called myocardium, right? Which is not surprisingly the vast majority of what the heart actually is. And then there is an inner lining. You can see it's kind of more purpley in color. That is called the endocardium, and it's basically a very smooth lining. It covers the heart valves as well as the large blood vessels. Again, it's there to help make the flow of blood as smooth as possible. Again, you don't want friction there, wearing down either the myocardium or causing undue turbulence. As far as external anatomy of the heart goes, one of the things you'll notice is that the apex or the point of the heart is actually facing down and slightly to the left. Which means that as it's kind of like shifted a little bit, like kind of twisted a little bit, as we look at it straight on, what we really see prominently is going to be the right side. The left side is sort of a little bit behind, out of straightforward view. So what we have are the atria and then the auricles. Now the atria are the chambers on either the right side or the left side, and then the auricles are simply these sort of appendage sections of it. Kind of think of like on your ear, that top part of your ear that kind of curls around. That would be like the auricle, right? It's just part of your ear, but it's that specific part. Below the atria are the ventricles on either side. So right atrium, right ventricle underneath, left atrium, left ventricle underneath. Superficially, the main sort of delineation between the left and right sides is going to be this anterior interventricular sulcus. There's also a coronary artery, the left coronary artery, going into this sulcus. What you'll notice too is coming from this right ventricle is going to be this large artery, even though it's blue because right now it's taking deoxygenated blood away from the heart to the lungs. That is the pulmonary trunk. And then you'll see the pulmonary arteries, again, taking blood away from the heart, going to the lungs. Now, this is something that's going to be very important. Arteries always take blood away from the heart. That's how they are defined as arteries. Arteries are not defined by whether or not they carry oxygenated or deoxygenated blood. They are defined by the direction of flow of blood. So arteries carry blood away from the heart, and veins are going to carry blood toward the heart. So what you'll notice here are the veins that are coming back from the lungs are actually red because they have now picked up oxygen and are bringing it back to the heart for the heart to pump out to the rest of the body. So this will be one of those places that you really need to be careful with your arteries and veins because the color is going to be reversed in that pulmonary circuit. Let's see, some other prominent features here externally. There is the ascending aorta. There is the arch of the aorta, and then which will go behind the heart. We lose it because we don't see it. And then we have the descending aorta right here. So that's our main artery of the body. Then we have our inferior and superior vena cavas. These are the two biggest veins that are bringing blood back to the heart. And then if we take a look inside, so here we have a better view of the atria, the right atrium, left atrium. You'll notice there is a valve that separates the atrium from the ventricle on either side. So the valve on the right side is either called the tricuspid valve, or you can call it the right atrioventricular valve. Either term is correct. On the left side, it is either called the bicuspid valve, or you can see here it's also another name for it is the mitral valve, or you can simply call it the left atrioventricular valve. Any of those terms are correct. As blood enters the atrium, it will flow past the valves into the ventricles. When the atria contract, they will push any blood that remains in them into the ventricles. When the ventricles contract, that's when these valves close. Like the blood flows backwards, right? It wants to go back up into the atria as they contract, but these valves prevent it. They snap shut, which means the only place the blood can go is going to be up into this pulmonary trunk, past these semilunar valves, or into the atria, or into the aorta, past these semilunar valves. So on here you'll see this called the pulmonary valve, or you can call it the pulmonary semilunar valve. Either term's okay. Or you see it on the side of the aortic valve, it's going into the aorta. Or you can call it the aortic semilunar valve. So again, as the ventricles contract, the atrioventricular valves will close, preventing any more blood flow back up into the atrium. This causes the blood to either go into the pulmonary trunk or into the aorta, depending on which side you're coming from. Those pulmonary semilunar valves are going to open, allowing blood to flow through. Once the ventricles relax and blood is no longer being pushed through the valves, blood will basically kind of fall back down due to gravity, either from the pulmonary trunk or here in the ascending aorta. And then you kind of see how these valves have sort of this cup-like shape that catches that blood, and that's what closes them. So again, as the ventricles relax, it prevents any blood flow from going backward. Oops, and I just moved that image. We'll notice here on these atrioventricular valves, there are actual strings. These are called the chordae tendineae. These are attached to something called papillary muscles. Those are going to be really important in making sure that the valves stay shut. We'll see a slide in a couple slides talking a little bit more about that. If we take a section of the heart in a transverse plane, what we'll see is that the left ventricle, the walls of it are much, much, much thicker than the right ventricle. Now, if you think about this, this makes a lot of sense. The right ventricle is pumping blood to the lungs. The left ventricle is pumping blood to the body. So obviously, or I think hopefully obviously, the distance from the heart to the lungs is very small, so you don't need a very strong muscle to get the blood just to the lateral sides of the heart. However, the left ventricle's job is to get that blood all the way up to the top of your head, all the way out to your fingertips, and all the way down to your toes. So that left side has to exert a lot more force, and so the walls are much thicker. The heart also has a skeleton, and now it is a fibrous skeleton. It is not a bony skeleton. So this is made up of dense connective tissue, and that allows a point of insertion for the muscles. So as they contract, there's sort of shape to their contraction, so they can move blood in a specific direction. It also acts as an electrical insulator, which is going to be very important. So as electrical signals go through the heart, they are going in a very specific direction, which also then will determine sort of how the contraction actually occurs. So, because you don't want unregulated contraction, you definitely want smooth contraction, almost like a ripple effect. And to do that, you have to have this insulation. We'll talk a little bit more about that in a few slides too. Let's just quickly talk about the systemic and pulmonary circuits. The systemic circuit is the left side of the heart, and then the pulmonary circuit is going to be the right side of the heart, as we just mentioned a little while ago. So systemic simply means it is going out to your system or to all the other parts of your body. And then the pulmonary circuit is simply going to the lungs. So that's what you're seeing here. Here on this side, you have all the blood that's coming back from different body regions into that right atrium. You can see it's deoxygenated. It's going past that tricuspid valve into the right ventricle. It goes past the pulmonary semilunar valve into the pulmonary trunk and the pulmonary arteries, where it then goes to the lungs. From the lungs, it picks up oxygen, and now it's oxygenated, and veins are bringing it back to the heart. It goes into the left atrium, past that bicuspid valve, into the left ventricle, past the aortic valve, and out to the aorta, as well as the other systemic arteries, out to the different parts of the body, where it then delivers the oxygen. And then this circuit is repeated. So again, this is the pulmonary circuit, and then this is going to be the systemic circuit. Now, just a really quick reminder about these valves. So here are here's the bicuspid valve. So again, as that atria is filling with blood, and as it contracts, blood will simply flow past the bicuspid valve into this ventricular area. However, as the ventricle closes, and blood will push back on this valve, snapping it closed. What you'll notice here, these chordae tendineae, these tendinous cords, if you will, when the ventricles are relaxed, when the atria are contracting, they're slack, again, allowing the valve to stay open. When the ventricle contracts, you'll see it's taut, and these papillary muscles are actually contracted. So think of it like if you've ever flown a kite, as that wind is picking up on the kite, you're going to pull down on the string so that the kite doesn't just fly away, right? So that's kind of what it's doing. It's the papillary muscles are pulling down on these strings to make sure that these valves stay shut and the pressure doesn't just like blow them back open in the other direction. And then here's an image of the aortic semilunar valve and the pulmonary semilunar valve. And basically just due to the way that blood is moving through the heart and out to the body and to the lungs. When the ventricles are contracting, again, the bicuspid and tricuspid valves are closed. These valves are open. It's also important to keep in mind that the blood that the heart is pumping cannot be used by the heart itself. So what I mean by that is any of the blood that's in the atria and the ventricles is under so much pressure that the heart can't absorb nutrients and minerals from within those chambers. It also needs its own blood vessels to the surface of the heart to actually feed itself. And that's what you see here. So right at the base of the aorta, you'll see there's a right coronary artery and a left coronary artery. The right coronary artery is going to curve around the heart toward the back. There's a main branch here called the marginal branch, and then there's this branch that's coming around the back and then down the middle of the posterior, so it's simply called the posterior interventricular branch of the right coronary artery. Coming from this left coronary artery, we'll see that it also feeds sort of similar, like a mirror to the other one, but in the front. So that's called the anterior interventricular branch. Now this time of the left coronary artery. And then the other split circles around to the side, so that's simply called the circumflex branch, again, of the left coronary artery. Now veins, so you bring blood to the surface of the heart, you also have to bring it back from there. In the front, we have something called the great cardiac vein that will take blood all the way back and around to the back to something called the coronary sinus. There's a small cardiac vein that will also take blood from the surface of the heart back to that coronary sinus, and then that coronary sinus will feed into the right atrium. When we talk about a cardiac cycle, what we're talking about are all the events or all the things that are happening in the heart associated with one heartbeat. So this is all the contractions as well as the relaxations. So here's some terminology for you. So systole is just a contraction. Diastole is another term for relaxation. Okay. So you can see as when the atria are contracting or when they are in systole, ventricles are relaxed or they are in diastole. Vice versa, when ventricles are in systole, the atria are in diastole, right? They're relaxed. Basically, that force of contraction moves blood from high pressure to low pressure. This is just a sciencey way of thinking of that. You know this intuitively. If you squeezed the bulb of like a turkey baster, it squirts water out. This is simply because you increase the pressure, and it's enough to push the water out. There is a short relaxation period. Both the atria and ventricles are relaxed. This allows the blood to flow back into and fill the heart. You know this intuitively. Our heart sometimes beats faster and slower. The faster our heart beats, the shorter this relaxation period is. And then also systole and diastole of the atria and ventricles also shorten slightly, just to get in more actual heartbeats. Whenever we listen to sounds of the body, we call that auscultations. So when I'm listening for your heartbeat, what I'm doing is I am using auscultation to diagnose health of the heart. The sound of your heartbeat comes primarily from blood turbulence caused by the opening and closing of the heart valves. So basically, when you hear that, you've heard like bump, 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 or sometimes it's called lub dub, lub dub. Those atrioventricular valves, when they are closing, that there's some blood turbulence that occurs, and that's that first lub. So atrioventricular valves being the ones between the atrium and ventricle, so the tricuspid, bicuspid valves. That second sound are those semilunar valves closing and the blood turbulence there. So those would be the aortic semilunar valve or the pulmonary, or I should say, and the pulmonary semilunar valve. All right, that's it for this section. We'll get into electrical signals in the next video.